Right, we continue with our focus on mental health care in South Africa. The Human Rights Commission has been checking on facilities around the country. Chairperson Bongani Majola joins us now to share what's been found so far. Thank you very much, Commissioner, for your time. Now, I know the Human Rights Commission is very involved when it comes to, the treatment of patients at hospitals. I know that there was a visit in the Northwest Province at a particular point. But tell me a little bit about some of the reports that have come out from the Human Rights Commission, particularly when it comes to mental health care.
Thank you for involving the South African Human Rights Commission. We have visited just one province, actually, but more importantly, in 2017-2018, we did a comprehensive hearing on mental health after the tragedy of the eSetimeni. And we learned a lot about that. One of the things that we realized with mental health in this country is that it suffers from a very chronic and systemic neglect, which is characterized by maladministration and actually lack of resources in this country. We have established that mental health actually is the least area of health that is receives any attention or much attention from the government, including in respect of resources, the human resources, financial resources, infrastructure, and so on. It's been extremely neglected. In our investigation, we also found that mental health depends on the mental health review boards that assist hospitals to manage patients and so on. And that in many of the provinces, those had not been established in spite of the policies requiring that they be established. And we recommended that they be established. The mental health policy framework also requires certain steps to be taken. And we found that very few of those had been taken.
Now, Commissioner, we've said so many things about mental health. Life eSetimeni obviously shined the spotlight on how mental health is, a health component that has been put on the back burner by government, but also by, South Africans at large. We only started to learn about mental health back in 2016, 2017, when that tragedy happened with Life eSetimeni. So, but today we still find ourselves having to discuss this. So it seems we haven't learned our lessons then.
Well, that's absolutely true. We haven't learned any lessons, and the Commission has been kind of beating itself to try and get provincial governments to even file reports on the recommendations that we made to them to implement, including the national department. We're getting very little responses as to the implementation of those recommendations. We were supposed to meet with the minister a week or so ago. The meeting was postponed, and one of the things we wanted to discuss was the whole issue of mental health, the security of personnel in hospitals, but also the security of the patients themselves, because in visiting some of the hospitals, we have found, for example, conditions that are conducive to the difficulties that have been reported in the media, where you find that patients get raped and or nurses get beaten up. And we have raised these with MECs in those provinces and, sometimes even with premiers in those provinces to say these conditions will lead to disaster. But very little has been done.
Very little being done, Commissioner. Are you saying that the government is not open to sorting this issue out at the moment? Are they ignoring the South African Human Rights Commission's warnings?
Well, it's difficult to say that they are ignoring the recommendations of the Commission. They are ignoring the recommendations of the Commission insofar as some of them are not even responding to the recommendations within the deadlines that we set. But we issued our report sometime towards the middle of 2019, and then at the beginning of 2020, we had COVID. And understandably, the government had to deal also with COVID. But we are worried, which is why we asked for a meeting with the minister about the state of affairs, because it doesn't seem that there have been any significant changes on the ground. For example, we have the National Preventive Mechanism under the Torture Convention, which visits places of detention, and they tell us that up to now, mental state patients are still detained in correctional services. We made the recommendation that those people should not be detained in correctional services. There is a High Court ruling that said they should not be detained in correctional services. And there have been other policy recommendations to that effect. And we will find that they are still detained with ordinary prisoners. We visited the new hospital, psychiatric hospital in Kimberley, and we found that there is a huge wing for state presidents' patients, but which was not open because of understaffing. There is no staff, there is no equipment, there is no furniture, and so they are left in the prison all that time. We made the recommendation to the MSC and to the Premier that they should be removed. To date, we have not received any report that says that this has been done.